Is there something that is making you sick?
You might have a problem with mold, candida, or gut dysfunction, and you didn't know that is what it was. Today, we talk to an expert to find out if you have it and what to do.
As a health coach and a wellness coach, we ask the questions so you get the answers. Let's get started as we ask.
Wait, what?
Hi, Leah.
Hi, how are you?
Good. How are you?
I'm good.
We would like to welcome our guest today, Diana Stafford.
Hi, Diana.
Hi, guys. Thanks for having me. This is great.
So excited. I have 1,000 questions. I feel like I have every single thing that you're going to mention, and I'm going to learn so much today. I'm excited.
Yeah.
Great to be here.
All right. So Dr. Diana Stafford is a board certified MD turned root cause detective. I love that description. Anyway, with over a decade of experience and 3 books under her belt, including her most recent title, Conquering Mold. She now helps clients heal from mold illness, candida, overgrowth, and gut dysfunction, reclaiming their energy, clarity, and quality of life. A mold literate practitioner and a member of the International Society for Environmentally Acquired Illnesses, Dr. Diana is passionate about moving beyond symptom management to help people truly heal. Kamna, dig in first because I'm going to go all over.
Okay, let's start with a question that a person might say, why do I need to know about this?
Oh, that's a great question because the medical system has kind of brainwashed or attempted to brainwash everybody into thinking that things like mold, things like candida aren't going to cause many symptoms beyond what they put into a little box. Like mold causes respiratory system or system symptoms. Candida causes yeast infections and thrush. Okay, other than that, like you're good, So, which is really not true because both of those can cause or contribute to systemic symptoms in every single body system. So really, everyone should be aware that it's not just viruses and bacteria that are out there and that are in our bodies, but the other 2 components of our microbiomes are parasites and fungus, which is candida or yeast and mold. So, it's important to keep them in mind because, for example, if you take a course of antibiotics, then the fungus is going to take advantage of the fact that the bacteria is down. It's going to fill that gap. Or if you have a big mold exposure, then it's not just going to cause respiratory symptoms. It's going to cause acute and chronic symptoms, depending on your predispositions and kind of the weakest links in your body. It'll cause a variety of symptoms for different people. So there are many, many reasons why people need to know about this. And, to my third specialty, which is gut dysfunction, the gut really rules it all. If you think, oh, well, if you don't have diarrhea or constipation or abdominal pain, then you're good. Again, doesn't necessarily follow because if you have, mental health issues, for example, 90% of your serotonin is made in the gut. If you have hormone issues, hormones are made in the gut. So it's all related. And I think that's the biggest thing, the biggest reason why is that a broad viewpoint like that will allow the listeners to prevent and also help any symptoms that they're already having.
Wow.
Okay, let me ask a very dumb question real quick. How do you say it? Candida? Candidia? How do you pronounce it?
So can I tell you, it's not a dumb question. So I had this video that I posted, really quick story. Last year, it got like 12 million views. It was crazy. It sparked this candida craze across platforms. I was like, oh, we got to write this book because everyone's apparently interested in candida now. Almost half of those people, I firmly believe, misread it as Canada. The video was called Candida Symptoms. And then these comments kept pouring in like, I'm from Canada. Like, what's wrong with Canada? I'm like, Candida. So, and then the other point to that is you can say it Candida or Candida because on my audiobook, I chose to have it stated Candida because that is, I guess, like worldwide the most common way to say it. Even though I'm like in the South, kind of. I'm in Virginia Beach, so it's I say it Candida. But it's I think that's more of a, Southern United States thing. So Candida would technically be like the most common way to say it worldwide.
Okay, but Candida. Candida.
That's how I say it. Yeah.
That's how I'm going to say it. That's how I wrote it out. Like,
That's such a funny story. Oh
I
my
know.
It's
God.
hilarious.
Okay. All right. Go ahead, Kamna.
No, so I have so many different directions I could possibly go. But okay, here's where I'm going to start with myself. Okay, let's
Okay.
just go.
Let's do that.
I have taken in the past year probably 4 rounds of antibiotics, and I feel like that's caused some imbalance in my gut. And when I talk to my doctor, they're like, "No, you're fine. You're fine. There's no problem." So, how would a person, not specifically myself, but how do you know if you have a problem with yeast overgrowth or mold or gut dysfunction? How do you know?
Yeah, so I do like to get testing. I mean, symptoms and testing. So some people are like, oh, I'm not going to get any testing, or like I can't financially. So they don't go on symptoms, but any symptom, like if you don't sleep well, if you are having issues again with your mood or anything like that, definitely gut issues. If there's any symptom, even skin, because the skin is an indication of can be an indication of liver backup if there are rashes or things like that. So symptoms, and I have a symptom questionnaire for Candida and a symptom questionnaire for mold. And those are in my books, and the mold one is also on my website. So because there are symptoms that are more strongly correlated. Of course, if you have a white plaque on the tongue, if you have frequent yeast infections, things like that, joint pain can be related to Candida. And for mold, it's like headaches on the back of the head, sharp pains, internal vibrations like you feel, or tremors where you feel kind of like there's a motor inside. Different, like a variety of different symptoms. Dizziness, very, very common with mold. So there are certain symptoms you're going to get like more points on the questionnaire for if you have them. So I like to tell people, okay, go take the questionnaire, because it's not like, oh, you could have any symptom. If there's only one symptom and it's not really specific for that, if it's like, well, I'm just tired, but I don't have like anything else. And it's like, okay, maybe you just need to address sleep or something like that. But if it's a few different things that kind of piece together and you're getting, you're like, oh yeah, yes, yes. Every time you do it on the questionnaire, like all of this is me, like in a nutshell, then that is very indicative of a fungal overgrowth or imbalance, because we all have a little bit of Candida in our bodies, but it very easily will overgrow. Mold, contrary to popular statement on social media, is not a normal part of the microbiome. So it is not like we all have mold in us. If you have a pulse, you have Candida, but you don't necessarily have mold unless you've had like a really significant mold exposure and you have mold colonization because of that. But you're not going to go find like random sample and have aspergillus, for example, mold being really common. Just so people can kind of get an idea, like, yeah, you have Candida, but if you've taken a lot of antibiotics, the body takes at least 6 months. And I just posted on this today, at least 6 months, 6 to 12 months, sometimes longer, depending on the bacterial population you're talking about, to recover fully from a course of antibiotics, no matter what any doctor is going to tell you. And I did primary care for so many years, prescribed tons of antibiotics, because that's what we did. And I would always tell my patients to take probiotics during the antibiotics, and also to take a binder during antibiotics, because you're killing off about a bunch of stuff. A binder is something like activated charcoal, or there's like zeolite clay. I also use some other binders that are like bioactive carbon, like variety of different binders that I'll use. And probiotics do help with some binding as well. But basically, it's something that's going to grab onto toxic byproducts and help you eliminate them more rapidly. So
are they like a chewable, or like a?
You can. So they're in variety of forms. I mean, and since I work with all ages, including kids, like I've given them in any kind of form: powder, gummy, capsule, chewable. Like it's, it comes as like powder, but it's in capsules or variety of different ways, liquid. There's any kind of way you can take a binder, and I have binder charts as well in my books. So because
I've never heard of a binder in my life.
So what does the binder do specifically when you're on antibiotics?
Yeah. So basically it's going to bind up and help you get out those, like you're killing off a bunch of things, right? You're killing off bacteria, good and bad. It's doing what it's supposed to. We need the antibiotic to do its job. So it's doing that job, hopefully. And then you have these like fragments and, bacterial cell walls and things that your body's trying to get rid of. And many times antibiotics have side effects, diarrhea being the classic one, but also just you feel like kind of drained sometimes taking antibiotics, and just kind of off for a while after that is really common. And I really believe that that's related to just the mass die off, of everything that it's killing off. And then those microscopic byproducts are then circulating. So that's I say that, and I've had a lot of good, results with people with that. It's not a very commonly stated thing, but that's my hypothesis and theory, and I'm sticking to it. So,
Okay.
So fascinated
yes.
by that. Like what is it? What, when you say activated charcoal, what exactly is that? Like charcoal? It sounds silly, but
Yeah, not like charcoal like you would grill on, but it's the same kind of molecule though. It's a carbon-based molecule, and it has a lot of pores, like microscopic pores.
Okay.
So those toxins and other things can just be in those pores, and then the activated charcoal brings it on out. Oftentimes it's bound to, those toxins are in bile as well. So one of our digestive juices. So you can see that bile will recirculate. Our bodies want to recirculate, like 95% of our bile gets recirculated. So we want to break that cycle. So the binders bind, strongly to toxins. Even things like trace minerals like fulvic and humic acid will bind to toxins. So yeah, I mean, it's definitely important. I wouldn't say, take a binder like every day of your life, but for example, I'll take a binder. I have binders around because I'll take it like after a sauna, for example, to like maximize the sauna benefits, because you're mobilizing toxins, and we're all exposed to toxins, even if you're not having active, like chronic illness, like severe symptoms, we all like glyphosate, like everything else, we're walking around every day, mold, like we're exposed to mold outside every day, like anything, can fill up the toxin bucket. And you don't really know exactly when that's going to happen. So I love things like sauna and binders for that. But I think we kind of went a lot of different places with that, but I think it's really important.
oh my God.
Yeah.
I didn't even know that people could have mold overgrowth or mold growth or whatever the proper
Right.
terminology is.
Yeah. Colonization. Yeah. It's kind of, I don't know if I should say controversial, but so we know that it can happen because, well, you can get like a fungal infection, right?
Mhm.
So fungal infection, you can get mold, you can get aspergillosis, you can get fungal balls in the sinuses. That's a thing. But then there's the toxicity, which is the mold toxin circulating throughout, causing inflammation. That's
Mhm.
not mold colonization. That's not going to make any mold colonies inside of you and like actual mold. But you can have mold colonies inside of you because you can breathe in mold spores. And spores can create
Wow.
colonies, especially in the sinuses, but also in the lining of the gut. So they can create them in biofilms. So it's mainly a biofilm issue whenever you have like mold colonization. And that's why I use antifungals with my mold regimens, which is probably one of the most controversial topics in the mold world, because some people say that they're either not necessary or things like that. But, I just stay up with the science and use what has been scientifically proven to help. So it just makes sense to me. It's like, okay, well, there's a spore and you breathe it in, and then, if your mucus doesn't get rid of it, then that environment inside your sinuses is very, happy for mold. Like mold would love to be in there in a moist environment, greater than 50% humidity with some organic matter in there. There you go. You got some mold going on, but it's not like mold growing and like, you know what I mean? It's not exactly the same as like
If
mold growing on your food.
something clicked for me, and maybe I'm wrong, I just want a clarification. But if you have distress in your gut, if you have gut dysfunction, if you have exposure to mold, or I don't know, whatever would cause Candida overgrowth, and we should talk about that, but then would that cause you to have more issues than if your gut was not in dysfunction?
Absolutely. Mold will kind of prey on your weaknesses. Like, yeah, I firmly believe and see the correlation between the state of the gut and the state of the nervous system too, and whether or not mold a mold exposure is going to affect you, because some people just breathe it in and it gets processed out, whatever, no symptoms, and others do not. So genetics play a part too. Like about 25% of people have MTHFR and HLA-DR types that via genes that will make it so that their bodies do not process out mold toxins, don't recognize the toxins as foreign properly to tag them and then process them out. So, it's all of these factors. So genetics are important, as well as the state of the gut, the state of the nervous system, and like stacked exposures. Like if you're being exposed at work and at the gym and in your car and at home, it's going to be worse than maybe your family member or friend who's only being exposed like in the car or something.
Okay, so wait, back up for 1 second, because you said something about a biofilm. What's a biofilm?
So a biofilm is like a slime layer inside the body.
Okay.
It is a protected layer of bacteria. Usually bacteria is in there too, which is important, and can have fungus in there like mold. And it's hard to get at because there's like inflammatory cells and other like extracellular matrix that's kind of latticed together and protecting it against the immune system. So we have to bust the biofilms.
So you don't want a biofilm, or you do want a biofilm?
So you don't want that kind of biofilm. It's
Okay.
kind of the body protects the other part, the rest of the body from having it by, it's multi-layered. So I think that's a really important question, but no, you don't want to have a bunch of biofilms around. So of that kind. So I use, there's some really good products for biofilm busting. Even things like stevia, though, is actually a biofilm buster. Xylitol, those can actually bust biofilms. So like just chewing like xylitol gum can help with biofilm busting. Like if I have a client who has like really high, starts off with like really high fungal load, then even chewing gum, like they'll get like die-off symptoms because it's so much like biofilm that they're dealing with. So yeah.
Okay. What was my other question? Oh, how did you keep mentioning like, well, and maybe this is the wrong time to ask this, but you said like the questionnaires first, right? What is the test?
Testing.
What is the actual test?
Yes.
Like, can I go to my doctor and request it, or is it like a, yeah, and
That's where, I think that was the other thing I meant to mention on that question. Yeah. So testing. So a couple of things with testing. So I love it. So I do love to get that information. For Candida, I use the gut zoomer. So it's a stool test, and that will test for Candida in the gut. Like I said, it can be localized other places. So you can have a Candida overgrowth like just in your mouth. But if you do have that white plaque on your tongue, many times it's all the way down. So, because the mouth is kind of indicator of what's going on in the tube. But the gut zoomer is very useful for Candida. It has Candida levels on there. There are also Candida antibodies in the blood that you can get done as well. None of these, I'm not going to mention, I don't actually think any of these tests that I'm going to mention are going to be something that a regular doctor will order, but I will comment on other tests that may be useful that would be. So for mold, there are two important tests. One is a urine mycotoxins test. Mycotoxins are the toxins made by mold, and they can be detected in the urine. The other one, so you can also test that in the blood, but that's antibodies, which is slightly different information. But in some cases, and it's a little bit nuanced, but in some cases I will do the blood test instead. And then the other one is an organic acids test, which is a really useful functional medicine test overall, because it can tell you a lot of information about like your mitochondria, your detox processes, some micronutrients, your neurotransmitters, like your serotonin and dopamine, but it also has a whole fungal overgrowth section. So that will show you byproducts of mold and Candida that actually come out in the urine. So if you have like a high arabinose, that's one of those metabolic. Arabinose is a metabolic byproduct of Candida and some molds. Like that's the one most commonly to be high on an O test, and those markers are high with Candida or some molds. So it is really useful to get those tests. Other things that can be useful, like if you have, if you're like, I'm not going to get any of these functional medicine tests, I would at least get inflammatory markers from the regular doctor, like ESR, CRP. Those are useful for just inflammation because you want to see like what effects is this causing in your body. And the biggest thing that it does is inflammation. So those are useful. There are some more specific ones, not specific to mold, but ones that are used more often for mold, like TGF beta 1. Like there's different markers that you can check, but biggest ones are going to be like your inflammatory markers, like ESR, CRP, and you want to make sure to just get like a CBC, CMP to see if it's affected, the liver strongly or something like that, or kidney function.
Okay, so these tests that you said, like the urine microtoxin and the gut zoomer with a Z,
Yes.
those, do you order those or do I go online and I order them from like a company, or like how would you, like if I wanted to get tested, how would I get those?
Yeah. So you can self order them. I have a
Oh,
lab site and people can self order them there. So I do not just have a lab on there without a consult with me, because just like Hippocratic oath, like I'm not going to just be like, here's your test results, like have
hmm,
fun, you know?
yeah.
Good luck. So I always include a consult on there, and a lot of providers will say, "Oh, well, I have it, so you don't have to have a consult," but they still mark up the lab price. So it's like, why?
Oh,
So a little inside info there, but it's I have a lab site, and people can self order it, and then the results come back in a couple weeks, and then we do a consult, we figure out like what's going on, talk about symptoms, and correlate them, and then we figure out the plan.
Wow. Okay.
hey, can we go, Leah, if it's okay with you,
Yeah,
two
absolutely.
ways? I want to start with the symptoms. Like, how would somebody know they need to come see you and get testing
Yes.
for both the candida and the mold? And then after that, what can the person do once they find out that they have overgrowth?
Yeah. And then I have a personal question.
Okay. Do you want to ask that now or later?
Maybe. Let me ask that now. Maybe then we can intertwine it. We recently, within 4 weeks in my home, discovered that my bedroom wall had mold growing on the drywall, but not that I could see. Do I have to worry?
Right. So it depends.
Okay.
If it's like a localized issue, like it was pretty new, hasn't been there for a long time,
Yeah, we
great.
have no
It's hard
idea.
to know.
Right.
Then so the best thing to do is to get a mold assessment, an environmental assessment of the home, because also they can test for like bacteria and stuff and other things that can be affecting you, VOCs and other stuff, just toxins. So, yeah, to get an assessment done of the home. And there are a wide range of professionals and non professionals, doing these tests. And, you can DIY it with some air sample tests and like petri dishes to get an idea of like one area. But if you're able to, the best way would be to get environmental assessment done of the home. I do, as you mentioned, I'm in the ICI, which is the International Society for Environmentally Acquired Illness, and we have a website, a list of indoor environmental professionals, or IEPs,
Okay.
which is who you really want. And while it's like some of them I haven't worked with personally, they've done certain numbers of certifications and passed, certain things
Okay.
in order to be on that list. So that's the first list that I would check as far as anyone wanting to find somebody. But otherwise, I don't have anyone in that area, but I do have, like, I work closely with a mold assessor who's actually in Florida, but he does like virtual consults.
Okay.
So he is great, like nationwide. He's very thorough. Like he'll talk you through exactly what you need to do. So he's also a great resource. And then, some of them do travel. Like he'll travel sometimes, but not too frequently. But because Florida, I mean, they get enough mold right there. But otherwise, some people will travel to the Midwest sometimes. So yeah, it's people, like, don't just call the first like mold guy you see it to come in and do an assessment, because they may take an air sample in the middle of the room and tell you that you're fine. And you're like, well, the mold
Oh,
was over there. So like you need to like swab that at least and like do a moisture assessment to see like why did this happen and how
Mhm.
can we just not have that happen again.
Okay.
So
mhm.
yeah.
Okay. Sorry. Now let's go and
Oh no, yeah, but can I say one more thing on that too?
sure.
So
Yeah.
just like briefly, because I don't know if we're gonna talk about this, but prevention for future, like especially if you had any kind of water
Yep.
damage, like dehumidifiers, super important. Less than 50% humidity is ideal to like halt any mold growth and prevent further mold growth.
Oh,
As well as like ventilation of the space and air purifiers. So that's like the biggest things for the home.
So you're saying dehumidifiers, air purifiers, and what was the third thing?
Just ventilating the space. So like stagnant spaces, mold loves that. Like your bathroom, if the fan's never on, then there's like standing water, and then mold's gonna
Oh,
potentially grow there. So it's like anything that there's like no air movement, you need to ventilate that, like open the windows, stuff like that. I mean, it's
okay.
hot right now, but like within
Right.
reason, like ventilate whenever you can.
Right.
Okay.
Right. Wow.
I just came up with more questions from just what you just said. So Kamala, let's go in your direction
It's
first.
like there's so much to talk about. I mean, I love talking about this stuff.
Well, I think the important thing that I'm getting from this is an issue that can potentially affect a lot of people. And we need to know, and we need to know
Mhm.
what to do. So
Yeah.
where I want to start is, how do you know if you have a problem? What are the symptoms overall?
Yeah.
I mean, I know some are
So
specific,
let's
but
do Candida first.
hmm
Okay.
So Candida, I mean, the biggest red flags for Candida overgrowth are going to be, so I've already talked about the white plaque on the tongue, or frequent yeast infections, or
mhm,
frequent like jock itch in the case of men. So as far as the other things, it would be like sugar cravings that are like intense, like all ages. I've seen kids who have Candida overgrowth who are like, they're coming home and they're like, I have, like, basically they're like addicted to sugar. And if you're like, yeah, of course I like sugar, but if it's not like, oh, I like have to have it kind of thing, then maybe not. But it's like intense sugar cravings. So going along with the frequent yeast infections, like UTI like symptoms, but then they'll say like you don't have a UTI or something like that. Irritation, any irritation in the area. Joint pain is actually big with Candida. It causes a
okay,
lot of joint pain. And then like rashes otherwise. So just like rashes on the skin, miscellaneous rashes that doctors are like, yeah, it's not a big deal kind of thing, but
Yeah.
medication doesn't work. And then with both of them, with anything, just fatigue and brain fog. So like that foggy feeling can be an indication of just toxin overload, because Candida produces toxins as well, which are technically mycotoxins also because it's a fungus, but
mhm,
we just don't appreciate that as much. But it does produce toxins as well. So for mold, I mean, far and away, the biggest symptoms I see, again, brain fog and fatigue. So across the board, like if you have that, it's something that needs to be investigated, and definitely relates to the gut, which also relates to potential fungal and or bacterial imbalances. And then those sharp pains, like it causes like nerve pain a lot of times, or
mhm.
any kind of neurologic symptoms, including those headaches on the back of the head. Very, like if you have a headache on the back of the head going around the neck, like very concerning for mold toxicity,
Oh, that's mold. Okay.
as well as visual symptoms like trouble seeing contrast, or like floaters or things like that. Frequently changing glasses prescription. So, like weird things with your vision, or like I don't feel like driving anymore because I just like see weird things when, in the light, or like sensitive to light, things like that, like neurologic kind of symptoms. And I mentioned dizziness before. Very, very big with mold is dizziness, which also relates to the occipital lobe of the brain, which I mentioned with those headaches. And then there are so many. I mean, again, rashes, but respiratory symptoms, of course, with mold. We have touched on that, but that's kind of the classic. But that's more like mold allergy. But you can, of course, still have respiratory symptoms and sinus symptoms, like frequent sinus infections and stuff like that with mold. And cutting down the immune system. If your immune system is down and you're like, I'm literally always sick, then there's a problem with your microbiome, whether it's Candida overgrowth, again, parasites, bacteria, virus, like there's a problem. So, we shouldn't be getting sick like every few weeks.
Well, I really like this list because I think people will see a lot of things, but the problem is, I know that the answer is going to be the testing is brain fog, dizziness. Some of these could be perimenopause symptoms,
Yeah.
joint pain. How can you distinguish this is a normal
Yeah.
part of aging or this is an actual problem?
Right.
Yeah. And that's a lot of the reason why people get dismissed as that, or like, well, just like maybe work on your hormones, or work on your sleep or something, and then, or work on your diet, or like exercise, and it'll, just get better. Or maybe it won't, but that's because you're still aging, as we went through that process, and so yeah, testing. And just, I mean, if there's any exposure, then that's like, oh, well, if you're
Right.
having a significant mold exposure, or if you have one of the classic symptoms, then it's like, oh yeah, well, I don't even need, like,
just
Right.
do a Candida cleanse. If you have white plaque on the tongue, I'm like, do a Candida cleanse. I mean, I don't even have to test,
Yeah.
It's like, I don't like saying that sometimes because people are like, oh, you don't want to like guess. It's like, no, I'm not guessing. If you have a white plaque on your tongue that doesn't brush off, and
Oh,
then it's usually
I
Candida.
want to look at my tongue so bad.
I know.
Like,
right?
yes, it can be bacteria. It can be bacteria, but usually it's going to have a Candida component. So yeah. Oil pulling, people.
Oh, oil pulling helps for that?
What's that? I
Yeah,
don't even know what that is.
It's coconut oil, swishing it around your mouth, or you can do olive oil if people don't like or can't do coconut. But
And you just put
coconut
that in
oil,
your mouth and it like,
You swish it
it's like
around
swish
for.
and spit. Yeah, I love oil pulling. Yeah,
Okay.
I don't even,
yeah.
I like coconut oil is thick. So you mean like make it warm?
Oh
then-
yeah, so you can either dissolve it in your mouth, or you can get the like always liquid kind. There are some brands that are always liquid at room temperature.
And you just literally swish it and spit?
Yeah.
I think it's for like 30 seconds or a minute.
One
It's
day,
just
like once a week?
Oh,
every
I
day.
do it every day.
Every day.
What? Like you brush
It's
your
like
teeth and then
replaces
do it?
mouthwash.
You brush your teeth
So
and
yeah,
then do it?
so you can do it for as long as tolerated. I mean, some people try to do if they really have a lot of film going on there. Like if you wake up with like a film in your mouth, like all over your mouth, that would be a great time to do oil pulling.
Oh.
For as long as you can. Like when I had some issues with like fungal balance, I would have like a film mouth, but I would wake up and like do oil pulling, and that would help it. And then so after the oil pulling, you just want to brush your teeth. So sometimes people do tongue scraping too.
What does it do?
Great question. Yeah. So the bacteria in the mouth and also fungus are lipophilic. So they love fat and they'll hold on to fat. So mouthwash is not even like all that effective. It's mostly like, it makes you feel like so clean and tingly in your
Yeah.
mouth. And it also has that, alcohol component that's like killing off some bacteria and stuff. But otherwise, oil pulling is more effective because it'll grab onto those particles and then you just spit it out.
Okay, so
Spit
walk me
them
through
out.
this. Do you like do a shot glass full of it or like I'm so confused.
So yeah, I mean, honestly, I've been doing it so long. I just kind of like it. It's like in a squirt bottle. I just kind of do a few milliliters there. I mean, it's probably not even more than 5 milliliters or just a teaspoon. So,
Okay.
some people do more, but it's
And
not
do you do olive oil or the coconut oil?
coconut.
Okay. I'm gonna totally try that.
Oh yeah.
Yeah.
It's a great.
It's harmless and you're not taking medicine or anything. It's just a swishing in your mouth. And if it helps
Yes.
you,
Okay.
Yes.
I think that's a good thing. Well, since we're
Mhm.
talking about things to do, let's talk about relief and cure,
Yes.
so to
Mhm.
speak.
Yeah. So we can talk Candida first. So for Candida cleansing, one of the biggest things is to address the diet. So taking out any added sugars. So then the follow-on question people always ask me is like, can I have honey? Can I have berries? Can I have citrus? The things that are like low sugar fruits and then like the sugar substitutes. So the answer is it depends because some people, if you have like raging Candida overgrowth, then like even that will tip up the balance. So sometimes I'm like, okay, see how you do with it. Like if you're improving and you're continuing to improve and you're eating a small amount of berries and citrus or like a drizzle of honey or something daily, okay, fine. But if you're not, then like maybe try cutting it out for a little while. So low in, and this is across the board for, I mean, any healing diet is going to be low in grains and like simple carbs and added sugars, low in that, and low in processed foods because those are high in toxins and generally very low in nutritional value. And then addressing, this is for any healing process, addressing any like nervous system issues, like are you in fight or flight? Like, do you need to process any traumas or things like that? Because that will keep you stuck. So giving a nod to the nervous system and then we can be a little more, environmental, making sure that your environment is one in which you can heal. So for Candida, as far as supplements go, for overgrowth, it's a fungus. So we're going to use antifungal, but we don't stop there because a lot of times people are like, oh, I was prescribed nystatin for Candida. And yeah, I mean, that's what is prescribed for Candida usually or fluconazole, but it's not, the whole picture. So you can cut it down a little bit with that, but a lot of times it'll come back. So when I was in regular medicine, they always told us like, put a refill on that because then it's like, we knew that it like wasn't
totally effective because it would come back and they're like, oh, I went and picked up
Oh,
my refill. So it's like, yeah, because Candida just kind of fluctuates if you don't really address it. Like if you don't get to the root cause.
oh,
Because Candida is like, usually you don't just have a Candida overgrowth problem. Usually there is a reason for that, like gut dysbiosis, meaning like the levels are off of some good and bad bacteria, or, you know, because of frequent antibiotic use or things like that, or mold toxicity can, because they're cousins and they like to go together. So usually Candida is not, it likes to join the party. It's not usually like the only thing going on, like in isolation, or it could be like other things too. Um, so antifungals, digestive enzymes are really helpful with Candida because it helps your gut give a chance to reset. Probiotics, there are certain probiotics that will compete with the Candida, others do not.
do
And
you have one you
then a binder.
recommend? Sorry.
Yeah, so I do a few different ones, but a good one to note would be a combo that has lactobacillus and bifidobacterium. So those are some strains that will help with Candida specifically, and a bunch of other things. But
Do you like the live or do you care like a, I don't have a brand in mind, but like Seed is over the counter. Which one do you prefer?
yeah, so probiotics in all their different forms have benefits. So yeah, I'll just use like some of the ones on Full Script, are really good with the lacto and bifido. And then, yeah, it doesn't have to, or I've seen that there will be improvements and there can be healing without using like a refrigerated probiotic, for
Yeah.
example. But yeah, and then binders because of the reasons we mentioned. So that's Candida. So for mold, I start with some anti-inflammatories because the mold causes a lot of inflammation and we want to make sure that, the body is able to deal with that. And then binders, of course, as we talked about. And then antifungals if needed. They're not always needed if there's no colonization. And then, really antioxidants like glutathione is a huge one for mold detox. So that is, something that I'll use really frequently.
Are
And
these
we
like
have to be,
vitamins? I know this is silly, but
yeah.
like, so is it like a vitamin I could go to like CVS and get?
Potentially. I use Full Script usually, the
What is that?
online supplement. That's an online supplement dispensary available in the
Okay.
US and Canada. And so it's shipped directly from there, which takes out the question of like, is this really what I'm getting kind of thing? So, or ordering it like directly from the supplement site. Or I also use some Cellcore products. So, yeah, like as far as other things to note, which you can definitely get at CVS, are things like magnesium and omega 3s. There's lots of like nutrients that are depleted by toxins that are useful to build back up. So just, boosting up your body to help it because, the biggest thing is we're trying to take out what's in the way of you feeling normal and functional and being able to do all the stuff you want to do. So that's really what it all comes down to, is taking out what's in the way. Is there a huge exposure going on somewhere? And we have to figure that out because, like I said, sometimes it's not at your home, sometimes it's other places, or sometimes it's from the past. And then, or what's in the way? Like, again, is there a trauma? Is there, your gut messing up? Like, is what's going on? So we have to make sure, the detox pathways are open. I just want to throw that little buzzword in there because it's definitely important in the detox world to make sure that, there's no constipation, lymphatic blockage, liver congestion, all of that stuff comes into play. So it's like a little bit more complex than people would like to think. I don't really love like the detox in a box kind of things because, I really think consulting with somebody who knows what they're
Yeah.
talking about with regard to
Right.
toxins is really important because if the kit is not right for you, then you can have detox reactions. I mean, there are these videos people post frequently about like they're going into like convulsions in their cars and stuff because
Oh,
they went and got like an IV drip of some random detox concoction and it wasn't the right thing for them. So
right.
I do have, I mean, it's pretty like standardizable, like what I do, but it's not like cookie cutter. Like you can't just do it
Right.
without reading any information on it whatsoever.
Well, it seems like you really know your stuff, and I would want more guidance because it still seems so complicated to me. I know it's probably simple to you, but to me, it seems really complicated and a little bit overwhelming. So if I had it, I would want someone holding my hand, so to speak.
Right. Yeah.
Yeah. Yeah. I mean, I do programs with people ideally. Like I do have those lab consults, but I do programs. I try to work with people for at least 3 months because, 6 months
Okay.
ideally. But, I really feel like, because I used to do a lot of just like one-off consults, but then, think people are busy and, you don't actually, you're like, 2 months passed and you're like, I didn't actually do what you recommended so it's important to follow up and have more of like a program for it if people are really serious about just feeling better. So.
So it takes up to 6 months, Ken?
So healing from mold can take years. Yeah, for sure. I mean, there can be lasting damage. Mold can cause, yeah, mold can cause brain damage. I'm like, it gives me chills every time I say this. Mold can cause cancer. Mold can kill you. Like it can be really bad. So, and people don't even know. So it's really, mold can just like rock your world. So crazy. I mean, Candida can too, but like I said, it's usually like not the only thing going on, but
Mhm.
Candida
How
can really
long does
mess with you
Candida
too.
take to get out of to get balanced?
It depends. I mean, I just saw like a client the other day that finally has a normal Candida, or we really feel like it's completely under control and it's been like a year, so it depends on the person. I mean, there's a lot going on there. And again, it depends on like what the underlying things, like how many layers are we dealing with here?
Right.
So it's like how we peel back the layers and then we're like, oh, now there's like Lyme disease or like something else. We're like, so
Oh.
it's like a whole other, yeah. So
Wow.
So if a person wants to come to you, do they have to get a referral from their physician or how does it work? Do they just come to you directly?
yeah, no, I'm like smiling because sometimes I do get referred from physicians, but oftentimes physicians are going to be like, yeah, that's kind of quackery or something, which is totally
Yeah.
not. But, and, I was a regular doctor way back when, but thankfully not anymore. So, so yeah, people can just go to my website and just literally book a discovery call with me right now. And I'm saying that, and my business is like constantly evolving and my offerings for people are constantly evolving as I see what's helpful for people and what works the best. So currently that's what we're doing. We have these programs and we have, of course, books, and I am making courses. I have a lot of short form, content on all the platforms. My other name is the Detox Doc. So that's like me on all the platforms. Detox Doc is my name and some people don't even know my real name. So it's like that's fine. So that is a lot of what I do, but I do have some courses in progress for people. And like I said, we're writing the second edition of our gut health handbook, which we put out a couple years ago, but there's so much new science we want to put in there. So
Sorry.
Yeah. Wait, back up. So oh my God, I lost my train. Your books. Then you have the two on your shelf if anybody's watching this. The Conquering the Mold and the Candida. You can buy them on Amazon or on your website or both or what?
but yeah, Amazon is the
Both.
direct way to buy them. And then yeah, our gut health handbook is called The Inner Journey. So like keep that, we're in progress on the second edition of that one. But yeah, Conquering Mold is almost 400 pages. It's definitely our longest book. It's the only mold book out there that has actual pictures of mold in it. It's like it'll show you. It's like straight from what is mold all the way through like how can you heal from mold. It has lots of tables and charts and useful stuff. And the Candida book again it's about 100 pages. It's a really good quick read on Candida and like how just kind of like wrap your mind around like it's not just like yeast infections.
Yeah.
So.
Oh my God. So they can basically someone could see you through Zoom because you're in Virginia Beach. So if somebody's in
Yeah,
Ohio,
Zoom.
we can.
Yeah,
Okay.
like this is what I do. Yeah.
Okay.
I would love to pick your brain maybe in another episode about gut health because I think we didn't even touch that topic. So
And
Mhm.
if
depression. And
yeah,
Oh
yeah.
yeah.
Oh, can I ask another personal question? I have been battling scalp itch for every doctor I see says it's somebody else. Somebody said it was bad dandruff. Somebody else said it was psoriasis. Then this and then that. I'm like losing my mind over it. What could that be? Yeast? Can you get yeast?
Yeah, it could be. It could be fungus on the scalp. It wouldn't yeah, it could be a yeast not necessarily candida, but potentially other
Oh,
yeasts. But still it's yeast probably
yeah.
or potentially. So yeah, a lot of times what I'll do with people for itchy scalp if it's not just like a dry skin situation, then doing, yeah, antifungal kind of shampoos can be useful. And depending on like why, I guess. But
Yeah.
but yeah, just as simple as that can be useful.
Okay.
Mhm.
Sorry. That was perfect.
Castor oil too is good for the scalp.
Castor oil?
Yes.
I heard that's a miracle thing. Does that really work if you rub it on your belly?
It's one of my favorite things. It helps
You're
with
buying
so
it
many
today.
things.
I am too. Wait.
I love castor oil. Yeah. Go on my full script and get the one in the glass bottle because you don't want like microplastics in there. But I use it as like my nighttime moisturizer. It's very sticky. So word to the wise, it is like an anti-aging, detox miracle. I think I can use that word for that. Yeah.
Like, do you,
Mhm.
okay, sorry. Like, when you say, like, I like rub it on my belly?
Sure. You can do that for either constipation or general like detox or do like a castor oil pack over the liver, but you can do it topically to wherever you need.
Oh, you can drink
You
it?
So you can. Topically is better or more widely applicable. Like it's a strong laxative if you drink it, but topically is useful without being like.
What is it? Is it vegan?
I would imagine so.
Do you know?
I'd have to double check. I'll double check.
Is it
But-
like, I don't know what it is.
I mean, I would have to double check on honestly like the processes in which it's made, but I do know that
It's
it
witchery.
absorbs everything. So you want to make sure that you just use it carefully because
Okay.
it's sticky. So and it's also like strong, I would say. So for people who have like a really, really high toxin load, then maybe a small, quarter size area may help. But then if they try to like slather it all over themselves, then they probably have like a detox reaction.
Oh my
So
God. I gotta get that. I gotta do, we gotta do a whole episode on castor oil now. Okay.
sure.
All right. So we have to have you come back to talk about the gut. We have
We
to.
have to.
Yes.
'Cause
Yeah,
I for
for
sure
Yes.
want to do the gut and mental health. And you want to do
Yes.
the gut and other problems, right, Kamna?
Yeah, for sure.
Sounds good. Sounds good.
Thank you
Before
so
we
much.
get off with you, we will be figuring another time.
Okay. Sounds
right.
good.
You're
Thank
amazing,
you.
and I appreciate all of your knowledge. Clearly, you're very passionate about this, and you know your stuff.
Yes,
So
I love
Thanks.
it.
we will put your contact information in our show notes, so people want to reach out to you for an appointment, they can.
Thank you.
Thank you so much.
Thanks. Awesome. Talk to you guys soon.